I'm a professor of palliative care at the Parent Institute for Neurological and Translation Science and also at La Trobe University in Melbourne. The Parent Institute is in Perth, so I work across 2 states. My main topic that I presented on my keynote presentation was on carer support. What are the ways we can support them from diagnosis to bereavement? Because the focus has always been on the patient and the carers tend to be left out, although they are at the center of helping the patient have better quality of life, better quality of care and better quality of death. And it really starts from the time they're given the diagnosis. It really needs to be given with a lot of empathy and care and compassion. And unfortunately, about 36% of patients and carers said they were not satisfied with the way they had the diagnosis, and that's really affected them for the rest of their journey, which is really a death sentence from the start. So we were trying to see if we could help improve this with mainly the neurologists who give basically the diagnosis at the time, and bring it up to some better practice standards that we have from European countries. The other way we can support the family carers during the caregiving period is not just assess their needs. We know their needs, we know that they need, but it's also addressing them and getting some intervention to help them survive that journey. So we assess their support needs, but then there was an action plan straight away from the health professionals that they put in place, and that's shared by the family carers. They kind of have that conversation, and it's done on a systematic way. So basically it's reviewed, and therefore the focus is on the carer, not just on the patient all the time. And this proved to have reduced the caregiver strain and distress during the caregiving period, but also had helped them during the bereavement experience. And then the last phase of supporting them is after the death. Because at the time when they're caregiving, you have a whole army of people in their house. And in fact, there are 22 health professionals who need to give help one way or another during the caregiving journey. And then they say we're left all by ourselves and nobody really asks us how we are. So again, the survey that I've done recently, we've asked them who basically gives you support. And as in the general population, family and friends play a big role, and that's why we really need to give them more skills to be able to help. Funeral providers come third, which is amazing. We didn't know that. And of course the GP and the MND associations, these are mainly the top people who give them support. Now the other thing that's worth mentioning, when we looked at the grief levels of MND carers, they're much higher than the general population. So fewer of them have got what we call normal grief, and that's why lower risk, but then a lot are in the moderate grief and the high grief. So we really need to look at the interventions that we could do for each level. The moderate ones, we need to train more volunteers who have had lived experience to basically give them that support. But then the high risk, they really need mental health professionals to look after them. So we need to still look at this for them. Again, we had the ones who had higher grief had more anxiety, more depression, and also family dysfunction, which another thing we need to unpick, as we do that. And really the last message I've given is that, looking after bereaved people and being around at the time of death and dying is the responsibility of the community. It's not the responsibility of health services. So the more we can be compassionate in our approach to supporting the family who have an MND, in fact any terminal illness, the more we are a better society for that, because specialist palliative care services cannot stretch that far to actually give support to everybody who's got a mental illness. Limited resources. So therefore, we need to work together, the community networks and the health services, to fill in the gap where it's needed. And that's mainly in the social and practical support. And so I talked about, how the compassion communities model is now rising everywhere. It started from Australia, and so we've started a compassion community model now in Bunbury, which is 2 hours drive from Perth. And we're trying to evaluate the impact of that on reducing hospitalization, because they don't need to be in hospital, when they've got social and practical needs, and certainly they all want to die at home, but of course this is not happening. They're ending up in the hospital. So I've left this message with everybody. basically to feel more responsible, and it's everyone's responsibility to basically rally around a patient with MND and their family carers during the caregiving journey at end of life and beyond that during bereavement. So, in a nutshell.